question to you, sir, would be about what bronchial artery embolization is and when is it needed?
Actually, it is a minimal invasive intervention. So, bronchial artery embolization is the procedure where we selectively block the bleeding vessel or bleeding branch of the bronchial artery.
So we'd want to ask, what are the indications of this particular procedure, bronchial artery embolization?
The most common indication with which patient comes to us is a massive hemoptysis. So most commonly there are underlying diseases. In India, most common underlying disease is TB, and other diseases like chronic granulomatous infections, then cystic fibrosis, then interstitial lung diseases, and sometimes there are underlying vascular malformations like pulmonary AV malformations, pulmonary arteriovenous fistulas, or some ruptured bronchial artery aneurysm like Rasmussen aneurysm. And sometimes there are underlying coagulopathies because of the other reasons.
Why is bronchial artery embolization better from a conventional modality of management?
But many times in conventional management, patient don't get complete relief. And in those cases where patient presents with massive hemoptysis, with low BP and basically emergency scenario, where bronchial artery embolization is a life-saving procedure, without which just giving the blood transfusion and medication, most of the patients can't survive. So for complete management, bronchial artery embolization with conventional management is the best approach rather than just going with conventional treatment.
Sir, if I ask you about the clinical experience with the cases that you have managed for bronchial artery embolization, what would be your opinion?
Many patients comes with bleeding from any of the side, because most of the patient land up in some emergency case scenario. It's more than 90% of the cases, according to my experience, it has been life-saving procedures up till now. So according to my experience in my setup currently, it has been very effective in the management of the hemoptysis cases.
What message would you want to give to the general physicians, sir, who are watching this about managing the patients in their OPD setting after the procedure has been done on the patient?
So once they go to the primary physician in their OPD, they will have to treat the primary disease, whatever the underlying pathology for hemoptysis. Like in case of the tuberculosis, which is the most prevalent cause in our country, they have to properly explain the patient about the importance of completion of the AKT or some other infections where what are the emergency signs whenever patient develop repeated bleeding, that time they have to visit in emergency. So proper counseling of the patients and relative are very important.